Hello, my name is Jaina, and the next part of the presentation is about factors that contribute to poor psychological health. I will be spending the next few minutes covering role diffusion and the environment, with particular attention to crowding, noise, and lack of privacy. We will take a look at what each aspect is, how it presents itself, and the effects that it can have on the occupational therapist. Role diffusion occurs when the same tasks are shared with different professions. For example, the occupational therapist and the physiotherapist both do transfers. Speech-language pathologists also do swallowing assessments. Nurses and OTs share some of the same basic wound care tasks. And the occupational therapist and the therapy assistants do many of the same interventions. This can impinge on the identity of both professions and have a negative impact on team relations. In one case, a professional who receives most of the referrals for a particular task might feel overworked, while the other feels underappreciated. Both professionals can lack in job satisfaction and, as a result, feel increased stress. There are many things in the environment that can have a negative influence on one's mental health. Some things in the environment that add to stress are not due to what the occupational therapist is doing per se, but are simply uncomfortable and might not easily be identified. It can be grating on the occupational therapist and cause him or her to spend precious time and mental resources distracted by a large pile of small things. The person may not be conscious of the problem or know where it is coming from because it is difficult to identify. Crowding, noise, and lack of privacy are also environmental factors that I will be discussing further. Crowding is basically having too many people and not enough space, adding a whole new level of complexity to the job. The occupational therapist needs to figure out how to regulate interactions with other people that are inevitably going to occur, but also to find time to get their own work done. It can lead to a decrease in productivity and, as a result, poor satisfaction with work because the occupational therapist is not finding sufficient time to complete all that they have on their agenda. More space allows for interaction to happen as needed while making provision for independent work to occur. Noise can be a help or a hindrance to a person's mental health. High levels of noise can increase the stress, levels of fatigue, and emotional exhaustion of the occupational therapist, whereas low levels and familiar noises can have positive effects. They can even be a comfort or a reassurance. A lack of privacy doesn't have to mean that the place is crowded. It can simply just mean not having a place to get away and take a sensitive phone call or to work independently. The occupational therapist having difficulty establishing this balance and not wanting to stand out will likely feel exposed and anxious. Even if the occupational therapist does not drop in productivity, the increasing stress and pressure on them can bring them closer to the point of burnout. Thank you for taking the time to listen to my section of this presentation. Following the references on the next slide, I introduce Jessica, who will continue the discussion of factors that contribute to poor psychological health in occupational therapists.